everybody. I want to take a minute to introduce our esteemed panel today. I'm Laura Mitchell. I am the CEO of GrandCare Systems and a co-founder of GrandCare. I have been in the aging, connected health, and technology industry for the past 16 and a half years. And I wanted to also introduce Charlie Hillman, who is the previous CEO, now the chairman of the board for GrandCare and the founder of GrandCare, engineer by trade, MIT grad, our chief nerd officer. And I wanted to introduce Daphne Carban, who is a registered nurse and also clinical implementation specialist with experience specifically in integrating and implementing technology into the home healthcare space and palliative care space. So you should find some of that very interesting as we delve into some of the problems and challenges that we're talking about today. I wanted to allow Nora and Lou to do self-introductions, and then I'll hand it over to Charlie.
Hi, I'm a clinical social worker, and my background has been in case management and healthcare systems and aging field. I'm a accredited case manager and an aging life care coordinator, and I implement the technology on our side of getting people involved in their own plan of care and moving forward in these tough times.
And I'm Lou Piro. I am an elder law attorney by trade, also an entrepreneur, and most importantly, I've been a caregiver 4 times over for my mother, my father, my aunt, and my uncle. And through those experiences, I learned a long time ago that the resources available for in-home care were lacking. So we have been developing, Nora, myself, and a team of people here in New York, a system with care coordination and technology bundled to bring services into the home and to create what we have always called a virtual home care environment. And lo and behold, recently, the whole healthcare system is moving in the same direction. So I think we're going to talk a little bit about that today.
Absolutely. And, you know, and actually, Lou is more of a serial entrepreneur. We're always joking about when you sleep. We're not sure if you do. Because you own, you know, you have about a bunch of businesses, but all dedicated to advocating for making care better for our aging and disabled population. And I think you're going to find today on this panel, I'm really excited about it because I'm going to try not to talk too much and let really the folks that have had their hands deep in implementing the technology and dealing with the resident, dealing at point of care, dealing with the family and the challenges and obstacles. And I think it's going to be very fascinating and hopefully a positive, uplifting experience. So with that, why don't I turn it to Charlie to talk, you know, to walk us into sort of the state of the industry of why we're all here.
Okay, thank you, Laura. Thank you all for attending. I'm Charlie Hillman, co-founder and semi-retired board chairman of GrandCare Systems. So today, we're going to hear a lot about solutions, staffing strategies, reimbursement trends, and of course, technology. But before we get into all of that, I always like to start with the need. In other words, why is this important? Why have we assembled? The answer is pretty easy, as the need is daunting. Back in the mid-1990s, I had a need. I was taking care of an elderly relative who at the time was in her late 80s. She was a stubborn Swede who very much valued her independence. She had no interest in living with us, and even less interest in living in congregate living. She wanted to live in her own place, period. And yet I worried. So I cobbled together what would today be seen as rudimentary technology, but it did work. I was able to make sure she was up and about in the morning, that her furnace had not malfunctioned, and my favorite, that her TV would automatically turn on so she wouldn't miss Lawrence Welk. Bottom line, she died peacefully in her own bed in her mid-90s, and I was blessed with peace of mind. Fast forward a decade and GrandCare was founded. My thought was that if I needed this so bad, there must be millions around the world with similar needs. As it turns out, we were probably a little early to the game. As well, the demographics were clear. The payers, specifically the government and the insurance companies, had yet to see an impact on their bottom lines. And that, my friends, has changed dramatically. We've all heard the stunning statistic about 10,000 boomers signing up for Medicare every day. And that's going to happen for the next decade. Consider also that the oldest boomers are only in their mid-70s and are just starting to get into their extreme healthcare needs. And it's not just about aging. We need to save money in post-acute care and to take better care of our disabled citizens. I particularly like the disabled market as it results in so many happy outcomes. These are often younger people who perhaps for the first time in their lives are living independently and are able to do their own thing and contribute to society. At the same time, we've heard of severe staffing shortages and the result, in my opinion, completely justified increase in wages. And speaking of caregivers, I cannot think of a more noble profession than caring for another human being. I salute you and I thank you for your service. And since I'm a boomer who will likely require more care in the next decade, I wish you Godspeed. So there's clearly one solution, the judicious use of technology to create a generation of technology-empowered caregivers, able to know without wasting gasoline that their charges have accessed the refrigerator, taken their medication, and their glucose or blood pressure was okay. And further, to be able to see and reassure their patients from anywhere. I guess you'd say we need a team of cyborg caregivers. Maybe we should call them the Carenator. I knew Laura would hate that, but I like it. Carenator. We'll see if it catches on. So I'll end with a statement that I have made in most of my speeches over the years. The people of GrandCare have heard it many times and likely sick of it, but I will say it nonetheless. If this nation does not wake up, embrace technology for caregiving, then the boomers will bankrupt their children and their grandchildren. And as a boomer with 7 grandchildren, that I cannot abide. Thank you for your attention. Back to you, Laura.
Thanks, Charlie. I wanted to also take a minute to bring this up is the fact that the origin of GrandCare was because of Charlie's story, but as we have progressed, we have been finding that GrandCare has a dual market, half in aging population and half in the intellectual and developmental disability population. So we will be addressing both today. And in fact, Nora and Lou do serve both populations. So anybody that I saw that there was a question in the chat asking if we are addressing both. And yes, we are addressing both today.
Absolutely.
The use of technology can actually really kind of pours over to both aspects. Sometimes when we create a feature for one population segment, we find that it's very helpful and useful in both. So we will be talking about that as well. And I just wanted to clear that up. Can I turn it over to Lou for a minute here? I just wanted you to give us a little bit of your impression with all of your experience in the home healthcare industry and caring for your own parents. What you see in the state of the industry, we all kind of, I know we're preaching to the choir here, but what you see is happening in this industry and what needs to happen.
So the elephant in the room is the staffing crisis, and everyone is facing that. How do you recruit, pay, train, and retain the right caregivers to put in the homes that you're serving? And we have every year an elder law forum here in New York. It was our 27th annual most recently. And we had a whole panel with all the New York State experts. The head of the Home Care Association chaired the panel, Al Cardillo. And they went through the trials and travails of trying to bridge the gap between the current shortage and the population that's growing in terms of the need for care. And the statistic on the screen there, by 2100, 77 out of 100 people will either be younger than 15 or older than 65. So who does that leave working? So we think, and we've been working for a number of years now towards technology solutions, not to replace care, but to bring care up to a different level, utilizing automated tools that leverage the care that you can provide through the best-in-class caregivers that you recruit and train. When clients get to me as a lawyer, and I've been practicing law doing this for 38 years, they're usually in crisis or they're very foresighted and they're in planning mode. But we deal a lot with clients in crisis. And as they say, send lawyers, guns, and money. You know what? It's hit the fan. And by that point in time, you need a team of people. So in our law practice, and I'll segue to Nora with this, in our law practice, I saw early on, 20 years ago, my mom had Alzheimer's, and none of the resources available in my mom's hometown, which is a small town, really solved the problem that finding care and providing it in the home. So I hired a geriatric care manager, which is what they were called at the time. And it worked. We were able to get care, find care, put a system in place in the home that enabled us to manage my mother's care in the home, which is where she always wanted to be for a number of years with very advanced dementia. What I found in my law practice, and I brought that care manager in and hired him and made him part of my law practice. And we've had care management in the home for many years. But in the hospital systems, we were dealing with discharge plans and those clients in crisis. And I met Nora when she was working at a local hospital, one of the leading hospitals in upstate New York. And she at that time was the head of discharge planning. She also worked in care planning with a group called Choices. And I would call Nora up on the phone and say, Nora, here's the issue we have. And we would always get a solution from the inside. But healthcare has changed. And Nora, those solutions that we used to be able to put together for people, they don't exist anymore.
No, it's really gotten to be very complex. With managed care, they're pushing people through the system so fast that there's not even time for families to plan. And the biggest thing that I have long been an advocate for is to help older adults and their caregivers make informed care decisions, because it's unfair that somebody comes into the hospital and can't walk and really is looking for help, that we're saying, well, you know, you don't have an acute need and you have to pay $2,500 a day because your insurance won't cover. So we're very proactive and engaging caregivers in active planning as to how we can develop a short-term plan and a long-term plan. And older adults, I've had many people say over the years for older adults and disabled is, you know, well, they don't want to get any care. They do if it's the right care and if you actively engage them in their plan of care. And that's what we don't do because we're so rushed and overwhelmed. And COVID has really done a number on healthcare professionals, and it is really overwhelming now because we have such a healthcare shortage that the technology couldn't be here at a better time. It's just reteaching and helping people have a different mindset about how to take a new approach to an ongoing care issue.
And Laura, I couldn't agree with Nora more. All of these things were moving along and percolating, but COVID has just been the accelerator. And
Absolutely.
so CMS, the Center for Medicare and Medicaid Services, the Biden administration, state governments, everyone's looking for this solution. So the technology fits in what's really a revolution in healthcare. And I think if there's one bright spot that we had out of our recent conference, it's the movement of Medicare, Medicare Advantage, Medicaid, private insurers, all towards a patient-centered healthcare system and towards a home-based system, which leads right into home healthcare and home health agencies. So Laura, turn it back to you with that.
Absolutely. You know, and that it really just plays quite nicely into, well, how does the technology fit in there? And, you know, speaking from the disability population world, I talked to a disability service provider here in California just a week ago who told me that they have 25 positions available for staffing and they're having such problems. So the staffing crisis is not, that's across the entire world, the entire all populations, but I think especially for caregiving service populations that there is a massive shortage in caregiving, whether it be from the aging perspective or disability. So let me turn it to Daphne, because I want to hear a little bit about how you see technology playing a pivotal role from, you're a registered nurse, you take care of patients on a day-to-day basis. How do you see technology fitting, and how does it help you as a caregiver and as a professional, a clinical professional, to sort of take away some of that noise?
Yeah, so I want to echo what you and Lou just said about the staffing crisis. I was recently at a nursing home that I had last been at 2 years ago. And when I went back 2 months ago, they had 100% staff turnover with the exception of one janitor, like administrative staff, caregiving staff, everyone. Nobody from 2 years ago when I was there was still there. So, I mean, you want to talk about everybody's brand new, and then who knows what's happened in the 3 months since I was there. So it's just crazy. And I think we can use technology to assist with these sort of needs. Charlie talked about needs. I actually, Charlie and I didn't even discuss it before, but my thoughts on this were really needs focused. I'm not sure in healthcare, we're really familiar with Maslow's hierarchy of needs. So it's a pyramid, and at the bottom, they've got 5 levels, and it's sort of what needs we have. It's based on curiosity. And on the bottom, the widest part of the triangle, it's physiological needs. So, and you're going to talk a little bit about specifics later, but, we're able to address that with some vital signs stuff, meal and hydration reminders, that kind of thing. We have to be able to breathe. We have to be able to eat. We have to be able to, have hydration and good vital signs. And then the second tier of that is safety. And we're able to do a ton with safety surrounding technology, whether it's sensors, alerts, using, combining those vital signs into an alerting function that helps sort of alert us to early changes in condition. But then the top 3 in the triangle really are, belonging is the next one. And I think that's where maybe in healthcare we fall off sometimes, where we forget to think about how do we engage people in their own care? How do we make them feel belong and, feel a sense of belonging? And the belonging can be, between the caregiver and the individual that has the technology, or it's engaging the family, or it's both. So that video and photo functionality really sort of bringing people into a sense of belonging in their own care. And then the top 2 kind of go together. Esteem is the next one, and self-actualization is the very top one. And so these are all, basic human needs. But, especially those top 2 for people that are in the disability market, really helping them to enable their self-care. So in other words, can we have to-do reminders that help them sort of remind them to do things for themselves that maybe in the past we've just sort of said to them, oh, you didn't do that, you forgot in a blaming way, when instead we're giving them tools to sort of take that on themselves. Calendar reminders, medication reminders, all of those ways in which they can feel that they're a part of the care. And then I just wanted to kind of wrap up that section with a little bit about what you said. It's funny how many people say, my mom, my family member, my mom has a GrandCare as well. And she got Lyme's and needed some blood pressure monitoring from her nurse daughter. I decided that, and she said, okay. But it was just funny how I was using it for the medical purposes, but really for her, it was all about the photo engagement and the belonging, and me sending pictures when I went to Spain to see my daughter. And so it's pretty amazing, but I think we can really address all those needs. And then everything, the role of technology that you had on that past slide, everything really does fall under that care, that tier of needs and self-care.
And, isn't it true, when you were talking about the staff turnover, and you sit there and think, okay, so 2 years ago, nobody's there. So who knows the patients, right? Who's the carryover that says, okay, so this patient likes this and this resident likes this and whatever. I think partially technology can also play a role there, because technology doesn't turn over like that. So you've got the technology in place that knows all their vitals for the past 3 years. It knows, it's got all of their family members, it's got all of their medications in it. So it really is a piece that is staying and can help the, new staff come in and know the resident or the patient, whatever we're calling them, longer. Sorry.
And also do more of that with fewer staff, because, we can't, it's hard to address change remotely. It's hard to address it with fewer caregivers. And so if we have this, technology-based solution, while, especially in home care, we still have to go there, we're able to have meaningful pings in between the visits that really hopefully move things along a little bit faster than they might otherwise.
Yep. And Laura, that leads to the discussion of interoperability, bringing the healthcare system together. There's a big push at CMS for better electronic health records and a better management of electronic health records and sharing of data. And much of what we're doing with the technology is gathering that data and allowing it to be shared in an appropriate way with the appropriate audience, whether it be a primary, a specialist, a hospital, a telemedicine, emergency room physician, having all of those things available, and they live in that client's and that patient's own program. So if there's a different caregiver on Monday than there is on Wednesday, all of those things stay consistent. And that's one of the big advantages of technology.
Absolutely. And that's exactly what we're talking about here is, we talk about healthcare and aging services and disability care and things being siloed. And I think part of the problem too is we've got technology pieces that are siloed, right? We've got a medication reminder here, and we've got a telehealth system here. And I think, as we delve into the technology, I think you're going to see that that's the value, which is why I really wanted Lou and Nora to talk today, because not only, we think we have a pretty comprehensive system with GrandCare, but they've taken it one step further and they've really integrated it beyond that, which I will let them talk about in just one second. So I wanted to, I didn't want to focus too fully on the technology because I think we all kind of know that there is technology out there, but I wanted to give a few minutes of conversation to what technology we're talking about. So this is the GrandCare system. We've got a 17-inch touch computer appliance that is at point of care. It's always on, always available, always listening to the sensors that may be deployed around the home, and always in the same spot. So it doesn't get dropped. It doesn't run out of batteries. It is an appliance in the home, much like, where your microwave is at all times, where your TV is at all times. So this is in the same spot. And it acts as a source of information, reminders, letting them know it's time to take your medication. This is your daily schedule. Here's your list of tasks that you need to complete. Here's some breakdown of those tasks, if they're complicated tasks, so that they can actually go through the steps of their tasks. Here's some messages from your caregivers, from your family, from your friends, pictures, whether they're family pictures or social pictures from your community. Requesting services. I want to get my hair cut. I want to request that I have laundry done. I want to request maintenance, all of that at the touch of the touchscreen. And you can also play games. It's fun. It's engaging. And of course, there's also the ability to request support and services from a video chat perspective, HIPAA compliant video chat, or just be able to check in on the touchscreen. And of course, we've got all of these sensors that are deployed around the home. You don't have to have any sensors around the home, and you can add them in as needed, but they may be from motion sensors, door sensors, telehealth devices, and all of these sensors are reporting to the GrandCare system, and they're being graphed, trended, and reported so that the family or the caregivers can set up parameters of when they might want to be notified if something seems amiss.
I think I'm gonna add in there, Laura, how important it is for things like vital collection to not only get that information to family or professional caregivers, but use it to have someone take control of their own life and their own situation. That influence life, to make sure that someone knows having an awful lot of salt will raise your blood pressure. I think that's so important. And once again, gives them that independence and feeling of controlling their own lives. And I think that's so very important. Anyway, continue.
Absolutely. And anybody else, feel free to jump in if you've got any thoughts as we go along here.
One thing I can say is I think that we need to turn the verbiage around. We look at older adults as not being capable. They're very capable when you give them the time and the understanding so that they can make changes. And the bottom line is they want to be in their own home, and there's nothing more motivating for them to have that wellness center. And we refer to it as a wellness center, not, that you have to monitor all your chronic conditions and that. But this is your wellness center, and this is what we're going to do is to help guide you in how to take care of yourself and be an active participant in your plan of care.
Absolutely. Absolutely. So important. So important.
And especially with the disability population, a lot of times our clients, this is the first time that they're ever being independent, and it's really exciting. And we're giving them tools to, like Nora and Daphne talked about, to self-empower and take care of themselves. So we're giving them tools to remind them to do when and how to do things. And in fact, with some of our disability service providers, they were able to remove caregivers from some of the group homes completely, only having remote supports in their call center available 24/7 to be able to answer video calls and to be able to respond to alerts with motion sensors and things like that. So it was a huge spike of independence, and it was very empowering for those clients.
And I just got to add in there, we are relatively new to the disability world, but we've had some nice installations. And it has been so heartwarming to see how this has improved people's lives. And quite frankly, quickly shown that we are reducing staffing requirements and making that super caregiver. It has been very clear, much clearer than in past aging installations. But I just love the group home idea. And we've done an awful lot of work to support that. So it's very cool. Very cool. Anyway.
I want to take, Laura, if I could, just a minute to go back up to 30,000 feet and look at where the healthcare system is taking all of this and why this technology is so timely and so important, especially to home health agencies who are serving people in that home. There are a lot of articles being written. There's a McKinsey study that I'll quote from in a minute, talking about how healthcare has evolved, and the whole shift is to value-based payments and looking at allowing patients to be able to control their own care, to participate in that care, to treat the whole person, looking now at social determinants of health, which have never been part of the healthcare system.
Yes.
And integrating social determinants, which GrandCare and VivaLinks do and focus on in addition to the healthcare. And when you're looking at value-based payments in 2023, those home health agencies out there know HHVBP is coming and is going to be part of everyone's world in healthcare. So how do you take all of these disparate modalities of care, home health care included? If you have an 8-hour shift of caregivers in the home, you're not in the home 16 hours a day. What's happening? Are they taking medications? Are they eating? How often are they going to the bathroom? All of those things, all those data points that you can't monitor because you're not in the home at that point in time can be yours through the technology. So you're able to treat the whole person 24/7 in the home with or without a live caregiver in the home, and to supplement that technology with your caregivers that are there. And I think, Laura, you're going to talk a little bit about the leverage that can be gained from that in a minute.
Yeah, absolutely. And I'm so glad that you brought that up, because I don't want to take too much time talking about the specific technologies itself. If you want a demo of how GrandCare works, we'd love to give that to you. We're not going to do that on this webinar, but please do reach out to sales@grandcare.com. Or if you want a demo or to hear more about how Everhome Care Advisors implements all of the technologies together, I definitely want you to reach out and talk to us. But can I ask you just a minute, Nora and Lou, just to tell us a little bit, some of the users may be interested or may be familiar with GrandCare, but can you tell us how Everhome Care Advisors takes that one step further and integrates with the Viva Links platform?
Sure, and I can explain this a little bit. Everhome Care Advisors is a care management company, independent life care coordinators who go out, do an assessment, and that's Nora's job, and she can talk to you more about that. But as we observed care managers and care coordinators doing their job, it became apparent that there were no tools of the trade. There was nothing that allowed them to perform those services. So when we started to develop Viva Links and the app that's in the Google Store and in the App Store, we looked at it from the perspective of a care manager who's working with families to solve every issue that arises and to incorporate all of the different modalities of care. And Nora, maybe you can talk a little bit about your experience with families and how the technology has evolved based upon your experience.
What we do is we go out and talk with that client and family and look and help them problem solve, their goal. What is their goal? They want to stay in their own home. Okay, how can we help them reach that goal? And we have, the ongoing traditional care management tools. I can call, I can make a referral in that. But what we didn't have was the virtual care coordination tools. So what we did is we have an automated care plan. And that care plan, we are able to set up what the goals are. And we use the remote patient monitoring. We automate that care plan so that it is on the app. So wherever that care manager or that caregiver is, they can look in at any time and see, okay, what does mom need? If they're looking at the sensors and that they're noticing that she hasn't gotten up yet, they can do an automated call. So these are tools that can help you communicate in real time. And I think it's a game changer for home care, because home care nurses are to be applauded because they go out there, and if they find that there's something going on in the home, they have to notify the physician. And a lot of times they're waiting for that physician to call back, and they can't move on. And then they have to get the supervisor involved in that. So think of all the stop and start that they have to do and all the people that they have to follow up on. That's overwhelming. So what we've done is in this app, we are able to use telehealth and access an emergent situation, telehealth doctor, to look at what the situation is to determine, do we really need to move forward sending somebody to the emergency room? Because a lot of times when we're sending somebody to the emergency room, it's very upsetting to families and it's very disruptive. And a lot of times that person doesn't want to go. And most of the time, in very few circumstances, do they need to be admitted? A lot of times things can be managed in the home if you have the right tools.
And the number one goal, the easily articulated goal, is a reduction of hospital admissions and readmissions. And that's one of the critical criteria in managing value-based payments, is reducing that healthcare cost with those hospital readmissions. So what we looked at when we developed the app is, what are the risks in the home that people fall prey to that land them back in the hospital? And if you start with a hospital discharge, we've integrated remote patient monitoring, and that's part of the system. You have the sensors, the cameras, and all the things in the home that measure not only falls, because they will do that, but also wellness. How many steps are they taking? When are they getting out of bed in the morning? What are they doing if they're in their chair all day long, they're not getting enough exercise? All of those metrics are measured using AI-enabled technology and reported back into the app and stored, and that data is collected and then is actionable And Nora mentioned the response. So you go from the basic gathering of data on a wellness basis through utilization, and we're very thrilled to be working with GrandCare and utilizing the GrandCare tablet because that is such a functional tool for people in the home. The caregivers have the app on their phone. They're able to monitor everything, the security in the house, all the way through to the motion, the pendants, the wearables, and right on through communicating, having the ability to just pop in through the tablet and monitor the situation. And then we've built a triage system, which culminates in an emergency level telemedicine visit. And we've been working in a pilot program here in New York with hospital emergency medical services, the telemedicine company, and our in-home technology. And we're having some interesting success with that. But when you look at all of those things together, the ER physician is on the line, on screen, in 7 minutes on average, versus a 911 call and a transport to the hospital with all of the things that result from that. And the statistics are startling how many of those hospital readmissions, when you have the early intervention system coupled with the telemedicine and you're able to triage and treat that issue in home, how many of those hospital readmissions can be avoided?
Absolutely. And also to add to that, in a group housing situation, so that there's a lot of group housing where there might be a few folks living together, and that is a little bit more prevalent in the disability space. But the technology pieces can really play a huge role in helping those individuals to stay independent at home. So for example, you've got 4 individuals living living together in a home with no caregiver, with just remote supports, but they've got their touchscreens in their room, they've got their sensors, their personal health devices that are managing their chronic conditions, and they can help them to help themselves, take care of themselves, but also remind them when it's time to do things, but also as a house reminder in public areas to be able to really enable them and empower them to be independent. So it really can work across a diversity of populations.
So Laura, maybe just take a minute, and I'll get to the role of government in a second, to talk about how the home health agencies can use this in their businesses, in their practices, to take everything that we're talking about, integrate it, and use it to manage things like electronic visit verification and all the things that they have to do, but then marry that to the patient-centered system.
Well, absolutely. So let's do that first. Let's keep with that, and let's talk about the implementation. I mean, I think this is really what I wanted to focus the most time on, because all of us know that there are technology pieces out there. A lot of us that may be on this webinar are saying, hey, I'm interested in doing this, but how do we do this? And Charlie often talks about the notion of, in the 80s, adding computers into the banking system. It was a feat. But people that didn't do it ended up going bankrupt. Their banks did not survive. So this type of technology is absolutely critical in moving us forward from man-on-man caregiving to zone caregiving, and to empower the patients or the residents or the clients to engage, and the family in their own care, and provide true patient-centered care requires an omniscient centerpiece, which is the technology. So this is where I really wanted Nora, Daphne, Charlie, Lou, everybody to share with us, what advice would you give? Someone is trying to implement technology into their caregiving services, whether it's a home health care provider, a home care provider, a disability service provider. What do they need to do? I mean, what pro tips would you give them, and what should they be prepared for?
I'm going to start with saying that fundamentally, the technology can't be viewed as an add-on. It's got to be used as an integrated part of your business. And I think that actually works pretty well, because think of the staffing that comes in. They're young, they're used to using technology, they like it. So certainly it has to be, some procedures have to change to use that technology. But so I don't think it's the caregivers probably will accept this. Obviously, the challenges are to have the patient accept this, but there are many strategies for that too. And I think certainly Nora is good at that sort of thing.
Nora's
how
got,
we get that.
Nora was just giving us a lot of information on that type of thing. And so go ahead and share with us what you see as successful implementation strategies and how do you deal with it?
Well, what I basically do is tell the family and that older adult or that disabled person, we hear what they want. They want to stay in their own home, and we can help them do that. And it's a combination of the traditional care management, but we also have to think differently and incorporate technology. And what I use is, an example is myself. And I use the example, I have a daughter that lives in Idaho, and I use technology to keep a relationship with my grandchildren. And if I can learn how to use that technology, then you can learn how to do it. And what is most important is that you have to look at what your goal is. So we're going to help you take those steps to keep you in your own home. And we're going to teach you the technology, and you're not going to break it. You're not even going to realize it's there. And we coach them and spend that time on helping them change that mindset. And when they have the tablet and they get the Viva Links app, it just opens doors because when they're home in their own home and they're not interacting with anybody, and then they get a call from their daughter and children from a different state, and they're talking about, I see you didn't have a very good morning. What can we do for you? It's time to take your medicine, and you're doing it. You got to coach them, you got to empower them, and you got to enable them. And what I find over time is it's sometimes you have to spend more than others, amount of time on others. Everybody's different in their learning, but they do adapt to it, and it opens doors for them. So that's the most important thing. We're working towards a goal that they want, their independence.
Absolutely. And Daphne, can you share a little bit too from your experience? I mean, you were integrating technology solutions, particularly GrandCare and others, into home health care a few years back, as well as palliative care. What did what was the installation like? Could it be done by a regular person, or did you have to install special forces, or what happened? I mean, I think maybe give some encouragement of the seamlessness of the process.
Yeah, it's really not a complicated process in terms of a technical background. So in other words, I didn't have any people on my team that were IT people or computer people. Regular nursing staff, regular home health aides, regular LPNs are perfectly capable of integrating with this process. Going back to what Nora and Lou said, really that focus starting with the patient, loved one, resident, and what it is that they need. And exactly what Nora was saying about adapting it to their needs. And so sometimes I would have people on service who I would say, here you go. And they would just fly and do everything. And I'd, touch everything and have a new glucometer. And then there were other people that were kind of reluctant in terms of technology. And I think sometimes that's the part of us energetic kids who get real excited and we want mom to FaceTime and we want mom to have all these other technologies. And maybe by the time they get to Nora or a home care agency, maybe they've tried 5 different things that were pretty difficult and now they're sort of tired of trying. And so having that sort of person-centered individual approach to get them engaged with the system and really thinking about what it is that's going to make them participate. And for every person that is a little bit different. The socialization aspects with the system really help with that. So I'll tell a quick story. I had this gentleman who was at home by himself, and he was diabetic, and every day he would get up and he would open up the garage door and he would drive around town and he would go have lunch and then he would come back, and his son worked during the day and couldn't be there. And so the son really was like, I need this system to help make sure that he gets home okay in the day, that I don't have to worry while I'm at work. And so we installed a garage door sensor that had, when he leaves, it sent an alert. When he came home, it sent an alert. That provided the son with a whole bunch of peace of mind. But what happened one day is I went out to the house and I was just doing regular nurse check, and he had a towel over his GrandCare. And I was like, what is this? And he's like, oh, he wants me to have this, and I know I need to have it because I have to stay safe, but I really don't want it. And so I just covered up because I don't want to look at it. And I got in the car afterwards and I called his son and I was like, what did I tell you about putting pictures on there? This is necessary. He needs to be excited about this. He doesn't need to just accept this. And so he said, oh, I'm sorry, I was busy. I'll get to it. And I said, you put those pictures on there, put titles with those. And so then the next time I went, it was just a complete 180. It was the screen was up and he grabbed me by the hand and he said, come here, look, there's pictures of my son and I when we used to ride motorcycle. I love this thing that I have in the house now. It's helping me be safe. We're sort of moving him along a continuum with regard to his diabetes management after that. So really just that one little intervention on a personal basis opened up the world of his safety and of his diabetes management ultimately. It's really amazing when you have that person-focused care, but then also what Nora said about the care planning. I think that's a really integral part. I had technology be a part of the care plan versus having it be this outside piece. And I think, Nora, if you'd like to talk about the care planning part a little bit, that's essential.
Yeah, I think the care planning is a crucial part because you have to teach them, what is it that is important to them that they want, and they see that you're actively incorporating that into the plan of care. And what I say is, this is not a plan of care that the doctor prescribed. This is incorporating what you want in your care, and you're dictating to other people what you want, and they're working with you towards that goal. That's a big difference between somebody that's being discharged from a hospital with congestive heart failure saying, you need to weigh yourself every day, and you need to do this, you need to do that. That doesn't engage people. And so that care planning piece is critical. The other thing that I just want to add is, from a caregiver perspective, having that coordinated communication and the ability to have free-flowing communication and not disjointed communication is worth its weight in gold. You can just feel the breath coming out of people because they're so frustrated by the disconnects in the system. And one of the things we have with Vivalinks is we have their documents, their healthcare proxy, MOS form, all of those important documents uploaded in the system so that they can pull it up if they need it, or if there is an emergency. And so it helps organize that caregiver and coordinating all those aspects of care.
And also, Nora, from the care management perspective for the home health care providers, iHealthHome is what we use to manage professionally that care plan and to integrate it with the service provision. Just talk a little bit about that.
We have the automated care planning process in our, as Lou said, we use iHealthHome, and so that's automated. And then what we do is that feeds into, the Vivalinks, and it's all HIPAA compliant. And those goals go across the continuum of care of all those providers that have access, that the client wants them to have access. What we do, another important piece is we ask that person, that client, who do you want involved in your care plan? Because again, we want to respect HIPAA and privacy, and their daughter may not be, they may say, no, I don't want that daughter involved because she bosses me around and I don't want to share that information with her. So we have the ability to be specific on what the caregivers and who they want involved in their care, so that we can only share certain things with the different caregivers.
And we mentioned earlier, I did, the government's role, CMS, the expansion of HCBS, home and community-based services. Medicare Advantage plans are now incorporating a lot of technology into their bundle of services. We think it's going to go to traditional Medicare ultimately. Medicaid certainly has a lot of this in budgets to put out there for people. And it's all on a data basis. So you need to be able to gather data, which is what the app does, and use that data, make it actionable. There's a great study, and it's in an article in McKinsey and Company's May edition, this healthcare practice. The article is called The Next Frontier of Healthcare Delivery. And it walks through where the healthcare system wants to go, where CMS wants to take it. And in New York State, we have a very innovative state office for aging. We're doing a pilot program with them. We're proposing another pilot program with them. So the government is getting behind this as well. And you either lead, follow, or get out of the way when value-based payments and value-based purchasing for home health agencies are becoming the standard. Fee-for-service healthcare is becoming a dinosaur and will be a thing of the past. So when that happens and we need patient-centered care, this quote, "The challenge of stitching together multiple modalities of care to build a cohesive patient journey remains an opportunity for innovators. If done correctly, integrating the many pieces of the patient journey and making smart use of technology to do so could create value for patients by supporting the delivery of better health outcomes in an easier to navigate manner." Home health agencies are being looked to lead in this area because they have the most concentrated workforce in the home. And we think this tool is the ideal tool to allow that to evolve.
And if I can just ask you to share as an owner of home care services, I know that there are a lot of questions, a lot of, people are leery of making an investment in staff changes and processes or making an investment in technology. I mean, can you share with the fact that that you can save money, that overall the technology will help to mitigate the staff shortage, that overall the technology will help to improve care and, of course, improve the bottom line for your organization?
Well, I think very honestly, in my days, I was working for an accountable care organization, and that cross-continuum communication. And for example, we had what are called zone sheets, and they were for people that had chronic illnesses, and it was red, yellow, green. And if you were in the red zone, it showed you how you were in the red zone. Automating that so that it's part of a patient's plan of care. When they go out, it gives them the tools to educate as they go. And, the ability to video in and, tell the patient, I'm coming today, and I'm going to be there at this time. Ease of use, and it's less wear and tear on that home health RN. The ability to call and update the care plan from their app. That ability speaks volumes because it saves on the wear and tear, which speaks to the burnout for healthcare providers, because it's a job that's not for the faint-hearted. And then when you're covering other people and trying to get to all of these patients, it really is overwhelming. So that coordinated communication and that ability to, video in the family caregiver and give an update saves a monumental amount of time. And you have happier customers that are happy and not saying, well, who is she telling me when to take my meds this way and that way? It takes the rub out. And, I always go back to the patients being called non-compliant. And, really, it's a lack of knowledge and understanding, but it gives them the ability to be that nurse that they wanted to be, to have those ability and time to teach that family and patient, and not always be on the go all the time. The other thing I can add is a lot of times, if you look in home care and you have supervisors, say the North team, the South team, East and West team, those supervisors are really empowered to look at who are the clients in their territory, and they can check in and see, you know, that aide, how they're doing today, if there's a problem. And think of the time that's going to be saved there. And this is very easy technology. As we said, it doesn't have, you know, you don't have to be an IT expert, but it's integratable. I don't know if I'm using the right word, but it's easy with your big medical record systems like Epic and that. These type of technology integrates very well. So you can do this.
There is also a question about how you use the technology, and maybe I'll call in a variety of you, including Daphne, of how to use the technology to ensure transparency and accountability of the caregivers themselves. How to use the technology to make sure that your caregivers are doing what they're supposed to be doing.
Yeah, you know, I mean, from just a really basic perspective, we have that caregiver check-in functionality. If that's something that an agency wants to use, they're able to see exactly when the person is in the home, to see what it is that they're documenting, and then to sort of flip that through if there's a change, just like, you know, Nora was saying, if there's a change and we need to do something now, to intervene right at that point, because we all know that staff accountability and documentation is completely improved if it's at the time of the event versus after the fact. And back in the day, we used to write a little notebook and take it back to the office and have all those long drawn out processes of do we try and get the person to an urgent care appointment. And instead, you know, what Nora and Lou are doing, it just seems transformative.
Right. And, you know, sometimes people are even using the touchscreen to introduce new caregivers that are coming in the home. So I've heard about this where, you know, caregivers were being turned away. You know, they would knock on the door, a new caregiver, and someone say, I don't know you. You're not coming into my home. And they were utilizing the touchscreen to introduce a new caregiver. This is what they look like. These are their interests. This is, you know, and even potentially doing a video chat with this new caregiver so that it wasn't, you know, because I can imagine you don't want, as a resident, you don't want care to happen to you. You want to be involved in your own care.
Yeah, as an attorney, Laura, I can tell you that the biggest complaint that we field from our clients about home health agencies is the inconsistency. When one home health aide is there and the next day they're not, you have another home health aide coming in, and individuals, especially individuals with cognitive issues, have trouble adapting to that. Using that video as a warm introduction before the face shows up at the door, I think, is phenomenal, and will go a long way towards bringing down the anxiety that people have about new people coming into the home.
Absolutely. Boy, that's an important point. That is really a big point.
We have on our Viva Links app a picture of the care manager, so that we say this is who your care manager is. So I've had many police called on me before showing up to a home, and you know, it really goes a long way, so they know who you are in that. And one thing I just want to share is, you know, in terms of accountability for the plan of care, I had there were friends taking care of an older woman, and I saw that they weren't ambulating her, and I called and said, I see that you're not putting down on the care plan that you're ambulating her. And he said, well, what do you mean? I said, well, you're not walking her. And he goes, oh, that's what that means. I didn't know that's what it meant. I mean, talk about clarification on a care plan. Instead of saying, oh, they're non-compliant, it was shame on me. It was the verbiage I used setting up that care plan. So, you know, it goes, it gives you the opportunity to correct and improve things real time.
Absolutely. So we are just hitting the top of the hour, and I feel like we could talk for another couple hours and not run out of things to say at all. But this was really great. Everybody, I was just enthralled listening to Lou and Nora and Daphne and Charlie talk about this. And this has been recorded, so it is available if anybody would like to listen again. And we will probably do another one just like this, because I think that there's a lot more to share. And I think we didn't even get to touch on some of the things that we wanted to talk about today, but that doesn't mean the conversation ends here. You can email GrandCare, you can call us, you can email Everhome and Lou and Nora, if there are any additional ways that they can get in touch with you, you can put it in the chat or you can share it right here. But any last words anybody wants to share as we close up?
I would just like to say that the future of healthcare, it's like the Titanic is finally turning. And to be part of that future and to look at what your agency, your company is going to look like 2, 5, 10 years from now, you're going to be going out and negotiating contracts with managed long-term care companies, Medicare Advantage plans, Medicare, private insurers, hospital systems. The entire increase in acuity in care in the home lends itself to you being the value-based provider. So we think that technology is really at the hub of that. info@everhomecare.com. They can email us if they want to have any questions. info@everhomecare.com. And this has been great. It's been a great conversation, and we're very happy working with GrandCare as part of the system that's being put out there.
Thank you. And we will stick around here for a couple more minutes if you want to ask questions in the chat. But also just make sure to continue on the conversation, reach out to us. We're happy to meet with your team one-on-one and share some best practices and answer any of the questions that you have.
All right, thank you, everyone. Let's get her done. Let's do this thing.
Thank you, everybody, for joining today. Sure appreciate it.